I chose to focus on polycystic ovary syndrome for my study this week. I looked at a clinical trial that looked at the correlation between clinical and hyperandrogenism, anthropometric, and metabolic and endocrine parameters. The study was pretty conclusive and it was a randomized control study. Polycystic ovary disease is a disease of the pituitary gland and it is a widespread endocrine disease. The symptoms that present are different in every woman, and in general, the pathophysiology is classified according to hyperinsulinemia with insulin resistance, hyperandrogenemia with hirsutism, cyclic reproductive problems, and chronic anovulation. Longer effects may and quite likely include uterine bleeding, infertility, and metabolic problems. I looked at other research as I was looking for this article, and it does seem pretty clear that obesity does adversely affect metabolic and reproductive outcomes for women with PCOS. In a nutshell, there was a positive Pearson correlation between hyperandrogenism, the anthropometric results, and the metabolic and endocrine results for these women. They don't know what the driving force of the disease is. And I call it a disease. I know they call it a syndrome, but it seems like a disease to me. But what they do know is that there's an overproduction of androgens by the ovaries with excessive insulin and luteinizing hormone. This triggers hyperinsulinemia and causes a release of gonadotropin releasing hormone. And it reverses the LH-FSH ratio, which increases androgen and decreases the creation of the sex hormone binding globulin SHBG. Insulin resistance and hyperinsulinemia are just they're bad partners, and there's going to be metabolic results when these are together. And the traditional symptoms of PCOS that we think of, including hirsutism, obesity, decreased insulin sensitivity, type 2 diabetes, cardiometabolic results, abnormal fasting liver results, high testosterone, depression, and anxiety all result from this pathophysiology. So, the elephant in the room about this disease is that I have it. And I was diagnosed at 20 with it. And up until that time, I had suffered from uterine hemorrhaging like a lot, acne, male pattern hair growth, depression, and anxiety. And when I got the diagnosis, it wasn't exactly reassuring because I just learned that I practically had diabetes. At the time, back then, they didn't give me any education or any instruction on the fact that some of this is manageable or that it's a disease that isn't incurable. And I went along my way until I was in my 30s, and I was noticing some insulin resistance, and I started looking at it closer, and I discovered that it really is something I didn't know. So I think for advanced practice nurses, we really have a role in helping women to understand that it's not just causing menstrual bleeding problems and infertility, but it has a lifelong impact. And I did experience all of the effects. I experienced the infertility, I experienced the hair growth, everything. And I will tell you that women like me need early intervention and early education and just a path to adapt to this illness. And I just thank you for your interest in this and your help with the women that you work with this syndrome in the future. Thanks.